Hi, my name is Amanda, and today I'll be teaching you how to clear an obstructed airway in the conscious adult. So choking is when an object gets lodged into the airway, and it typically happens from food when eating. So a person can have a mild airway obstruction or a severe airway obstruction. With a mild airway obstruction, they have some air passing through their airway so they can still cough and they can still talk. If they are coughing, you don't want to interrupt their efforts in trying to clear their own airway. If a person has a severe airway obstruction, then there's no air passing through that airway. So there's no oxygen getting to the lungs. So that means there's no oxygen getting to the brain or to the heart, and the person will suffer cardiac arrest and die. So choking is a medical emergency and you have to act quickly. So you need to perform a skill called the Heimlich Maneuver. And what the Heimlich Maneuver does is you are helping that person get the object dislodged from their airway so they can breathe again. So the first thing with the Heimlich Maneuver is you have to determine if they are choking. And the universal symbol for choking is hands around the neck. So when you have, I'm going to demonstrate on my friend here. So when you do the Heimlich Maneuver on somebody, you have to get behind them and you take one fist and you turn it sideways, and you want to have the thumb up against the person. And when you have it up against the person, it has to be centered to them. So you're going to line it up with their navel and their sternum. The sternum is this bone here in the center of the rib cage. So you're going to put the thumb, the fist, right underneath the sternum, and you're going to do quick upward thrusts. And what that does is push that air up to dislodge that object out so they can breathe again. So you're going to keep doing the thrust until the object is dislodged or until they become unconscious. Once the person is unconscious, in that event, you would start CPR. The Heimlich Maneuver isn't effective with people who are obese or pregnant women. So in that case, you would lay them down on the floor and do upward thrusts to be able to dislodge that object so they can breathe again. So I'm going to demonstrate on my friend Joni here. So the first thing I'm going to do, if the person is not coughing and not talking, then they are choking. So the first thing I'm going to do is ask, are you choking? Are you choking? She's doing the sign. She's not coughing. She's not talking. So come around and it come out. Okay, it came out. So now she can breathe. Thank you for watching.